process, you kind of push down in there a little bit, and you should feel something hard poking back at you. That's not a trigger point. That's your patient's first rib. So kind of find that, okay? And then what you're going to do, remember kind of the way that rib is aligned. When we do a depression, okay, our direction of force for this mobilization is going to be down towards the patient's opposite hip. Okay? So why would that first rib be elevated with a lot of our cervical patients with cervical dysfunction? Because those scalenes are tight, those scalenes are in a spasm. Okay? So a lot of times that first rib gets elevated. It also gets elevated in a lot of other people with cardiopulmonary issues. Why do you think that is? Because of the accessory muscles of inspiration, breathing at the scalenes. Okay? So what you're going to do to first assess is you're going to side bend them a little bit up towards the head of the table a little bit. You're going to side bend them towards the side that you're assessing. Okay? Your contact force is going to be sort of over the lateral aspect of your second MCP joint, so in through here. Okay? So I'm going to kind of bring my hand in and kind of contact right like this. I'll show you on this side too. You guys see that over there? Okay? So this is right over her second rib. Right there. Okay? Because whether I'm assessing or treating, my direction of force is going to be down towards this opposite hip. I'm going to come up to this corner of the table, stride stance facing that way. Okay? So first I'm going to come in, again, make sure you're over the first rib, not back over the spine of the scapula. Okay? And you're having trouble differentiating those two, let us know. So spine of the scapula is way back here. Okay? First rib is more in that space. Okay? In that triangular space there between the clavicle and the spine of the scapula. Okay? So I come in, and I'm just going to kind of, just going to kind of push down in through there and see what that feels like. And that feels a little tight on this side. Okay? Side bend in the opposite direction, and we'll kind of compare. The other thing that you'll see that I do, and I kind of do it without thinking about it, is I'll sort of lock my elbow inside my ASIS. So I'm pushing with my body, kind of right like this, so my elbow becomes sort of a stabilized arm here against my body, and so that I'm using my body to get that mobilization as opposed to just my arm pumping. Okay, so we'll see what that left side is like. Again, and actually doesn't feel as bad as the right. Does it feel different to you?
Yeah, that's hurt.
Okay, so how are we going to treat it? Well, we can grade our mobilizations 1, 2, 3, 4 just like normal. We can also use breathing to kind of help us a little bit. Okay? So what I'm going to have you do is take a deep breath in. And as she breathes in, I'm going to kind of follow that rib up and let it push up into my hand a little bit. And then as she breathes out, I'm going to follow it down. Okay? And I can kind of oscillate down there. All right? Okay? Then I can take a deep breath in again. I'm going to hold it down this time. I'm not going to let it come up. And back down. And relax. Okay? This is going to be a spot that's fairly tender, particularly if it's tight and it's restricted and you got a lot of things going on, which you do. Okay? All right, so try that. First